Imagine waking up with intense pain in your upper abdomen that refuses to go away, and then the pain starts moving toward your back. Could it be something serious? Pancreatitis can develop suddenly, sometimes becoming life-threatening. In the next few minutes, we'll reveal the warning signs, common causes, treatments, and when abdominal pain means you should seek urgent medical help. What happens when your pancreas becomes inflamed? Pancreatitis is inflammation of the pancreas, an organ behind your stomach that helps digest food and regulate blood sugar. It can be acute, meaning it develops suddenly, or chronic, meaning it continues or repeatedly returns. In this video, we'll cover the symptoms, causes, treatment, complications, and warning signs you shouldn't ignore. Important: this video is for education and doesn't replace medical advice. The pancreas produces digestive enzymes and hormones such as insulin. During pancreatitis, digestive enzymes may become activated too early, contributing to inflammation and pancreatic damage. Acute pancreatitis can develop suddenly and may be mild or life-threatening. Chronic pancreatitis is long-term inflammation that can permanently damage the pancreas and interfere with digestion and blood sugar control. Think of the pancreas as your body's tiny digestive factory. When inflammation disrupts the factory, problems can spread. Symptoms vary, but common signs include severe or persistent upper abdominal pain, pain spreading to the back, abdominal tenderness, nausea and vomiting, fever, fast heartbeat, bloating, loss of appetite. Chronic pancreatitis may also cause weight loss, diarrhea, oily or foul-smelling stools, and difficulty digesting food. So when is it an emergency? Severe abdominal pain, especially with repeated vomiting, fever, fainting, confusion, difficulty breathing, rapid heartbeat, or severe dehydration, needs urgent medical attention. Severe pancreatitis can cause dangerous complications, so don't try to diagnose or manage serious symptoms yourself. Seek medical care promptly if these warning signs appear. What causes pancreatitis? Two major causes of acute pancreatitis are gallstones. These can block ducts and trigger inflammation. Heavy alcohol use. Alcohol can damage the pancreas and increase the risk of pancreatitis. Other causes include certain medications, very high levels of fat in the blood, high calcium levels, abdominal injury, infections, genetic factors, autoimmune conditions, and some medical procedures. Sometimes no clear cause is found. This is called idiopathic pancreatitis. So how is it diagnosed? Doctors may use a combination of the following tests and assessments to diagnose pancreatitis. Blood tests, including tests to measure pancreatic enzymes such as amylase and lipase, which can be elevated when the pancreas is inflamed. Ultrasound scan, a safe and painless test that uses high-frequency sound waves to create live images of the inside of the body. It does not use radiation and may be used to look for gallstones or other possible causes of pancreatitis. CT scan, computed tomography or CAT scan, a medical imaging test that uses X-rays and a computer to create detailed pictures of the inside of the body. It can help identify inflammation, complications, or damage to the pancreas. MRI scan uses a strong magnetic field and radio waves to create detailed images of the inside of the body. It does not use X-rays. MRCP, magnetic resonance cholangiopancreatography, a specialized type of MRI scan that provides detailed images of the pancreas, bile ducts, and pancreatic ducts. It can help identify blockages, gallstones, and other abnormalities. Physical examination and medical history. Doctors will ask about symptoms, when they started, previous episodes of pancreatitis, alcohol use, medicines, and other medical conditions. They may also examine the abdomen for tenderness or pain. No single test necessarily provides the whole answer. So how is pancreatitis treated? There isn't one universal cure. Treatment depends on the cause and severity. Acute pancreatitis may require fluids through a vein, pain medication, medication for nausea, nutritional support, monitoring for complications, treatment of the underlying cause. If gallstones are responsible, a procedure or surgery may be needed. Chronic pancreatitis may require pain management, pancreatic enzyme replacement, nutritional support, diabetes treatment, or procedures in selected cases. What about food? Nutrition is important during recovery. Healthcare professionals may recommend eating when appropriate rather than unnecessarily avoiding food for prolonged periods. People with chronic pancreatitis may need individualized nutritional advice or pancreatic enzymes to help digest food. Be careful of online miracle diets or detoxes. No special food or detox has been proven to cure pancreatitis. Can it come back? Yes. Pancreatitis can recur, particularly if the underlying cause isn't addressed. Reducing risk factors, treating gallstones, high levels of fat in the blood, and avoiding heavy alcohol use can help prevent future episodes. So what are the possible complications? Severe pancreatitis can lead to fluid collections, which is a pocket of fluid that builds up in or around the pancreas. Pancreatic tissue damage, breathing or kidney problems, blood sugar abnormalities, malnutrition, and chronic pain. That's why significant symptoms deserve proper medical evaluation. You can't prevent every case, but you can reduce some risks by avoiding heavy alcohol use, not smoking, maintaining a healthy weight, managing high levels of fat in the blood, treating gallstone problems when recommended, following medical advice about medications and underlying conditions. Remember these 5 points. Pancreatitis is inflammation of the pancreas. Severe or persistent upper abdominal pain shouldn't be ignored. Gallstones and heavy alcohol use are major causes, but there are many others. Treatment depends on the cause and severity. Severe pancreatitis can become dangerous and may require urgent medical care. If this video helped you understand pancreatitis, like, subscribe, and share it. Disclaimer: this video is for general education and is not a diagnosis or substitute for advice from a qualified healthcare professional.